a few seconds. We will start. Just a few seconds. Second. Okay, I think we're good. Good evening, everyone, and welcome to Medical Mondays with Dr. O. What a beautiful day, but it's still hot in Maryland. I hope it's not too hot where you are. This month, the month of July, is Youth Mental Health Month. And so we've decided to dedicate the last 2 weeks of the month to talking about mental health because it's so important, especially in today's in today's, how would I say it? In our today's environment, we see a lot of mental health issues and we cannot pretend that they're not there. It's important for us to talk about it, to learn how to prevent disasters and how to intervene if, something is happening. So I am Toyin Okwesomi. I'm a physician by background, family practitioner who also treated HIV and substance use disorder. I host Medical Mondays with Dr. O, and I'm always excited to be here, even though we don't establish physician-patient interaction on this forum. We do learn a lot in prevention and in just healthy living. Tonight, we're going to talk, like I alluded to, about mental illness prevalence and diagnostic management. So when somebody is diagnosed, what is the management? And we would associate it with cultural dynamics, the stigma dilemma, and the need for awareness, looking at it from a socio-psycho-forensic analysis point of view. Because our speaker, Professor Ahmadu Baba-Sanghri, is a sociologist who looks at things from the socio-psycho-forensic analytic point of view. So without much ado, he's one of Medical Monday's family. I'm excited about that. I'm yielding the floor to our brother here, Professor Baba-Sanghri. Welcome. The floor is yours.
All right, thank you so much for the introduction, and I also want to welcome everyone. Again, my name is Professor Ahmadu Baba-Singhri. I am connected to this field in the sense that I'm a applied and clinical sociologist. I teach forensic science and criminology as a sociologist. So those areas also kind of move to criminal justice, where I also teach homeland security. And in that learning experience, I kind of look at the dynamic of human behavior, relating to either crime or non-criminal ones. Before I continue with my destiny, I would like to take an opportunity to thank everybody. I remember and be thankful to God for the release of the 42 school children in Oyo and the teachers. They are released to their families. We thank God. I know some of us prayed here, and we thank God that God answered our prayer. And so thank you for everybody that actually participated in all the prayers and the hopes. And so we thank God. I also want to point out also that, in fact, there were other students, almost over 42, that also kidnapped, this, I understand, the same day in Borno State. So we want to please pray for their release as well, so that they will join their family. And while we do that, we also pray and for the strength of the families that lost their loved one in this unfortunate and barbaric mentality, and we hope that must be stopped. So again, thank you so much, and thank you, Dr. O, for hosting this forum that actually gives us opportunity to discuss varying of things and ideas and issues that concern humanity. So I also want to thank you for that. And I thank the participants also. All right, so thank you so much. Again, appreciate it. All right, mental illness is one of the, I would say is very complex. The definition is not straightforward. And so when we say mental illness from psychology, we look at it from the psychology is differently. When you look at it from the sociology or what we call criminology, is kind of viewed differently. So we're going to provide that. So we have, that's why we have forensic science analysis and forensic psychology. And forensic psychology really deals a lot with the issue of mental state of a person. So what's mental illness? I said for us, we look at the symptoms, the symptoms that we see on people, one, and then it also can be in the, from a criminology, we look at the act and the individual act, we call it act real in the criminal justice. And then we look at the forming intent, right? So that comes to the state of mind, the consciousness. So when we look at it, we looking at, when we say somebody has a mental illness, are we looking at the fact that they are not conscious? They're not conscious, one, which basically may mean brain dead. Or are we looking at the fact that they have a distorted brain mind? And that's where the theories actually come. You have one, that our consciousness, because we being aware of our surrounding is an important part of human behavior. And then whether if we are not, then medically, basically we can say somebody is medically brain dead. So we don't consider other mental illness per se, but it can also be seen that way. But in social science, the focus is the distorted part of the brain mind. So is that what we are looking at? That's where culture comes into. So when we say youth, for instance, when we say youth mental state, or what really are we talking about? So we can look at it from the biological aspect, then we can look at it from the cultural aspect. So the biological aspect, when we look at it, as I said, we look at in criminology, we look at that there's a interaction between the genes and the environment that can affect individuals behavior or personality. And so that we call it the GE combination theory. So why is that important? Is that the brain basically is the engine, it's in everything, it makes things work. But within those genes, there's an important criminology. We look at it, there's an important enzyme in our system called monoacid oxidase or oxidase, depending on how the pronunciation is. Its short form is MAO. That thing, when we're looking at the behavior from that aspect, then we look at it, that's a genetic part of it. So in other words, how much of that enzyme does an individual possess and to determine his or her mental state, or sometimes antisocial behavior. Now, the antisocial behavior can be either aggressive or non-aggressive, of course, depending on whether we are looking at the level of dopamine or the level of serotonin, sorry. So it depended on that one. So that is one way we look at it. So then we say, well, our focus then to treat that one, if we are assuming that is the cause, is genetic cause, then we want to know where do we get the MAO, the monoamine oxidase, where do we get it from to regulate, because it is an enzyme that actually regulates a lot of brain activities. So now the findings for criminologists, when we are looking at individual behavior, or actions, we're looking at whether when that person has low MAO, then combined with neglect, which is the environment. So remember, it started with a GE combination, genetic environmental combination. So when we look at that one, according to the studies and findings, of course, that with low level of the presence of that enzyme, MAO, when it is combined with certain treatment of an individual or the child, or we're talking about youth now, for instance, we combine with certain treatment of individual, then that can elicit some kind of antisocial behavior in that individual. So in other words, for social criminologists, we're saying that, or biocriminologists, sometimes we refer that way, is that it is not the abuse of the child or neglect of the child or abuse of the child has to be combined with the level of this enzyme that regulates certain chemicals in the child's body in order to make them behave the way they do, whether they are being introverted or extroverted, or they are just experience autism or schizophrenia, or all kind of behavior, the negative one. That enzyme is critical in making sure that we make sure that it's not low, basically. And then the other part is that when we have high level of the MAO, even with the maltreatment or abuse of a person, the chances of antisocial behavior is little to nothing. So this is the finding when we're talking about mental state of human people mental state. So in other words, the mental state of that person, whether he's the way he acts, whether he gets angry, he gets sad, depressed, and all those characteristics associated with a mental disorder is dependent on the availability of monoamine oxidase or oxidase. So that's one of the when we look at it from the biological perspective. So in other words, it is it's not necessarily the consciousness as people we the most common things are your consciousness level, because we look at consciousness is whether you have it or either you're conscious, unconscious, or distorted consciousness. So in this aspect, we're saying that the consciousness can be distorted because of this genetic aspect of it. Then the second theory, of course, is the biochemical. The biochemical aspect, of course, is the most commonly talk about, commonly diagnosed or treated, which is the dealing with the alcohol and other drugs. But that's also biochemical. So we look at that sometimes when you take those things. Of course, there's something that is mostly people who say it's a non-fact. It affects your state of mind, and in PSU, your judgment and all other things. So that can we look at that from also the state of mental illness. So that's other things that we in the biocriminologists look at. Then the third one, which is the most common one, is what we call the moral injury. Moral injury. Now, that's a cultural one. Is what Freud called the superego aspect of our life, the moral ideal, or the psychologists would call it the moral ideal. And that's when sociologists would tend to refer to the cultural aspect. That's the one that determines your morality. Your senses are connected. How well did your culture instill in you a sense of guilt, the sense of shame, the sense of fear? And that's why what we look at it. That's what we look. So the moral injury can also create a state of mental illness, or can affect people. Moral can affect your moral judgment. How does it do that? Sometimes we find it in hatred, in jealousy, in resentment, in bigotry, and racism. So those are all moral things, and those things are usually cultivated within a culture, because in culture is a belief, or it is a way the general definition or description is a way of life. But culture is when we look at it, come from our values and beliefs, then it is those two things are norm. They are norm. That means they become our guide to dealing with people, how we deal with people. So if my culture, let's take racism in particular, if my culture believe that I'm superior to you, then I will always look at you and treat you as accordingly. Now, the person receiving the victim, now the victim, now experience sense of alienation or state of powerlessness. And that state of powerlessness that developed into certain mental disorder or mental illness like anger, frustration, and, and all those things. So those are the three dynamics of the three models. And when we're dealing with the bio or sociological analysis of mental illness. Now, when we talk about youth, we are talking about youth. So we say, well, is your youth? A youth, basically a young person. Their mental health is important. Then the question is, which of these do we use to try to understand their state of mental health? Which of these three things are we coming from? Is it that it is genetic? Or is it biochemical? They take some substance? Or is it moral injury where they are abused, their family members, they're abused by relationship? So which one are we dealing? So for sociologists, we look at it, we look at all of it in terms of, say, in other words, there's no one way per se. So while we focus on the symptoms, that he's angry, and for sociologists, we say, well, he's angry. Why is he angry? Or he's quiet. Okay, he's quiet. Why is he quiet in class? He's hyper. So why is he hyper in class? So this for sociologists, for forensic scientists, basically, we keep saying, okay, why is it? Why? What? In other, what are the antecedents that lead to such display of behavior that we in the public observe and norm it as either mentally ill or whether it's a happy or mental threat to mental health. So yes, we can see that. Now, if it is genetic, like somebody is mentally ill at birth, then we know that it's whether how much we can go to medical doctor, psychiatrist, basically. We look at that, try to find that. But the most common damages that lead to mental illness, according to forensic sociologists, is the distorted part of human mind. Remember one of the things, if some of us in psychology or social science, we deal with the mind is a blank slate, so we really hold that very, very dearly. That's why I bring the aspect of culture in it. The mind is a blank slate in the sense that you come without knowing anything. Everything that you are is instilled in you from now. It could be from your culture. That one of those culture could be a traditional culture in terms of your tribe or community culture, or your religious culture. That can shape your views about the world. And so when people say this person has this problem, sociologists or biosociology will say, okay, where are you looking at in terms of what model are you looking at from? Are you saying he's crazy because he's crazy, or mentally ill because mentally ill, or are we saying he displays behavior that is not acceptable to you, your own standard, and therefore we can label them mentally ill or mentally that, or is it real that they are not conscious enough to appreciate their environment and their interactive worldview. So those are the other things that we deal with. So that's why those in the criminal justice system will actually see that when there's a trial, when you look at it, there's a trial of an individual. The most common, sometimes people play insanity. So the plea of insanity fits into the idea of a mental illness. Basically that, okay, I'm mentally ill. I didn't know what I was doing. That means I wasn't, didn't know what I was doing. So I should not be held responsible or accountable for my behavior. So now for biocriminologists, or the question we asked is, okay, well, where did he or she commit the crime? And we look at it. We look at distance. We look at what behavior that was involved, actions, steps that was taken to engage to commit that crime. Did he take the gun? Did he load the gun? Did he pull the trigger? Did he aim at the person? Were there other people around? But he or she chose to shoot that person. Then if there was a choice, then the issue of mental illness is sometimes discredited based on those questions that we ask. So it's not just a blanket idea that people have mental illness and let's help them, but we want to know what actually is influencing their behavior. And two, one of the other areas with the sociology or social science is that human behavior, unless especially the psychological part, is not something that you can actually correctly say that it is what you see, because you don't see anything. We live on, it is lived on belief that, okay, I believe you, as you say, or we have to believe them. Why? Because we suspect it. So it become more of a suspicion. It become more of a suspicion goes into the framework of interpretation. Okay, so I'm interpreting behavior of this. Now, what we say is that, well, if you interpret this way, then some time when we go to court, we have different forensic analysts or psychoanalysts. And one is saying, no, this is A, and the other one saying this is Z. So that kind of strengthens sociologists' idea that mental illness is not something that can be really defined when it comes to the time to diagnosis, except the cultural aspect that, okay, we just want to believe. Two, we also look at it in terms of label. When I call you crazy, it's a label that I attach to you. It's not what you may believe, because you may say, no, I'm not crazy, but I say I'm crazy. Now, look at that one in terms of a psychiatrist who has authority and an individual who has no authority whatsoever. He's sent to a psychiatrist to be, quote unquote, evaluated. And psychiatrist will make observations and talk to him, listen to him or her, and come to a conclusion. Now, whether A, he's not crazy, or two, he's crazy, or is mentally ill or not mentally ill, sorry, basically. So that for sociologists, we say that it's not scientific per se, because it's an interpretative, so it is really not a known fact. It is an interpretive fact. So why? Because there's a model in social science called dramaturgy. We kind of look at it in that way. Dramaturgy means that people are actors and they act very well. They can act, they can fool. In other words, we can fool people in our behavioral display. If it is beneficial to me, then I can stick to what I want it to be, what I want the psychiatrist or psychologist to look at. If it is not beneficial to me, I will challenge it. Or, so my act is it possible, according to, so it's not that it is, but is it possible that people act? And that's a question that social scientists, and especially sociologists, ask. Is it possible that people ask? So the first premises in teaching forensic social psychology is that we don't trust people. We don't trust people based on what they say, or we don't trust people based on what we think we know. Perception is not reality. In other words, you may perceive them they have mental illness, or we may coerce them into believing that they have mental illness. So that's why for us, we say that there's a prevalence. So many, we are quick to label people mentally ill, and or is there a quickness to label people mentally ill? So when one of the things that we also look at is we look at DSM. Those who have been social science look at about DSM. So DSM has so many. I think the last time I looked at was 300, and somebody the other day was telling me there's up to 500 things that you can associate bad behavior, mental illness with. So every time you act a certain way, if you go to a psychiatrist or psychologist to diagnose you, if they're using DSM, then be certain that you will be labeled mentally ill. Either if they are very kind to you, they say you are on the border, you are borderline. That meant, we have a borderline. And so that's why we say that it becomes more interpretive. Because, so why is that important? Well, for sociologists, things are what they are. Human behavior is responsive to situation. So it's not, it may be a threat to see me getting angry at somebody, but the question, why did I get angry, is sometimes it's missed. We just say, he's angry, he's an angry person, he's an angry boy. So in other words, for us, we say, well, no, he's not an angry. It's like saying he's a bad person, rather than saying that the situation, certain situations make people behave in a certain way, right? Because people who have relations with their children, they don't treat their children sometimes the way they treat other people, strangers or co-workers. So that was another simple example that we push in trying to understand the dynamic, the idea of mental illness. Two, the label sometimes takes a very unfortunate consequences, because it becomes a stigma. Whenever you are labeled, for sociologists, since the label is arbitrarily, is taught is arbitrarily, according to sociologists, it's arbitrary. Now, when you are labeled, sometimes it follows you, sometimes your lifetime. I have, as a professor teaching criminal justice classes, sometimes in the department, we have students who come and say, well, I have I have a felony record. Can I get a job when I graduate from with my degree in criminal justice? Can I get a job in a criminal justice? And the reality is sometimes difficult. It's difficult. It's not impossible. It's 99.9% is difficult for them. Why? Because they have been labeled. If you have a mental illness diagnosis or findings in you, then it's hard for you to be a police officer. And so that's why I would say the stigma that is associated with it is very, is damaging as a negative consequences to the label, the person who is labeled. And that's why we say that we should not be quick to give a label to people. Now, our young people are growing up. Sometimes they experience things. Sometimes they experience bad behavior, or they experience bad things. It's okay. We for sociologists, part of what we call human development or child development. Okay, so he was angry at one child and he hit him. Doesn't make him a bad person. For sociologists, no, the situation, like him, he was responding to a situation. Now, remember, in the beginning, I said that now there is a genetic things in us. This enzyme in us also help regulate our behavior in every situation, whether in terms of, so that enzyme determines our response to situation. So the conclusion in this finding is that people respond differently in the same situation because they have different genetic makeup. Now, whether somebody is introverted, extroverted, it's not it shouldn't be a call for alarm. That's basically what we're saying. Where they are quiet. Now, when we say about autism, I know last time there was a time we talked a lot about autism. Autism, yeah, it's a new something, the phenomena that started in the early 1900s, and it's becoming very common. There's in that area that I would say, yeah, there's a biological or genetic aspect of autism. There's also a moral injury aspect of it. So in other words, we need to do a proper diagnosis to understand what is emitting that behavior. Observe behavior, because we are observing the behavior. Is the first thing we do is we always observe the behavior. We express behavior that we see. Do we ask questions? Right. Sometimes we blame. Well, back home we say, who is the parent? Right. That's a cultural aspect. Who raised you? Who's your parents? That you're misbehaving because of parents. So sometimes here, it used to be like that in the old days. My knowledge of literatures, but nowadays it's becoming more like is this just we focus on the child and we focus on the child, and then the next thing is also the chemical I talk about, the medication. A lot of sociologists in my area, we look at that there's over medication of children because we're trying to tame down. This idea that, okay, the child is supposed to just be quiet, sit down, be quiet. Now, the cultural aspect of it is that you look at how you grew up in Africa. Most of us that grew up in Africa, we were a 3-year-old, 4-year-old. We ran to the neighborhood, ran to this, that. We were running around, climbing trees. So we have energy to expand. We experience a lot of energy growing up. So whereas here, these kids have limited mobility in terms of interaction. Yeah, they have to go to the gym. Everything structured in the way that sometimes gives them the energy is not fully expands together. So it may actually create things that we may look at as, okay, he has ADHD or all those things that we label on them. He doesn't sit still, he talks too much, he hyperactive, and all those things. For sociology, we have to see, is it too much energy in the child? Does he have enough sleep? Does he have enough exercise? Those things are for social science important that we need to look at when we talk about mental illness, instead of young people in particular. So in conclusion, we're open to questions. I like to ask questions. Is that mental illness is a very complex thing, but also simple to understand. Simple because we have to understand humans as we are cultural beings. When we look at it as a cultural being, that means we develop. Even when some of the psychologists, psychoanalysts, from Freud to Erikson to Piaget to Lawrence Colbert, all talk about the stages of child development, which they start with the idea. Freud talk about the id in us, which is the hedonistic behavior, the childlike behavior that we have. Now, it doesn't end at the childhood. It grows, it continues with us lifetime because we see things we like. We want it now, right? We want to control situation now. Remember that. That's why for sociologists, we kind of put down domestic violence. The most common usage of the id, the Freud id, the instant gratification, we use it in domestic violence. Domestic violence is about power and control. And that power is not just the power that I want to control the situation. I want to control it now. So I don't want to talk about it. And that's it. Right. So we can look at it from that perspective, development. So we use it, so human development doesn't stop. Mental illness is an anomaly of human that has not been, it is hard to really pinpoint or get opinion and say, this is what mental illness is. So we come with everything from anger to depression to everything. So, for example, I say, why are you depressed? Why are you angry? Why are you happy? Finally, can I actually know what you are thinking? Thank you.
Wow.
And I leave any room for questions
Thank
and
you so much.
and we go from there.
Thank you so very much for the socio-psycho-forensic look into mental health. You know, I have some questions. And yes, you can raise your hands to ask questions or put them in the chat box. You said something about bad behavior or mental health. So, is it a fine line? Is it, is there a clear difference between somebody has bad behavior or they have mental health issue?
Again, when I'm in class, I take one day I take a glass of water. If you go, you take a glass of water, right? And then It's seated, it sits still, right? Then you come and take it and shake it. What does it do? It shakes, right?
It shakes, yeah.
Exactly. So that is your mental state. Your mind is it can be in peace, right? Constantly in peace. Is call it in the state of equilibrium. But sometimes it can then boom, something you interact with something or someone, then that equilibrium is challenged. So let's say, by example, let's say you are happy, you're happy and everything, then when you have received a news, your loved one passed away. It changes your what? Your behavior, it changes everything. Instant, your mood, it changes, the mood changes. It's the same thing like if you are just sitting there angry and then say, oh, you won the lottery, your behavior is going to be the opposite of anger or sadness or depression. So for social psychologists, is that everything is situational. The situation drives you, either the biological situation based on either it's genetic, which we have to deal with it from a medical or eugenics aspect if we want to change it, or it come from a biochemical drugs or alcohol that we have to now say we have to detox you. We have to detox it so that you can now start thinking clearly. The idea is that you think your clear thought process. Is your thought process distorted because of medication, drugs, alcohol, or is it distorted because of its genetical, or is it distorted because you are morally abused? So, the mental is not something that you're just crazy unless it's become chronic. Like a mental ill person for a sociologist is somebody who's just walking around, doesn't know what is going on. He's not aware of his surrounding. We can cross the road, we don't know. Give him clothes, he take it up and throw it away and run away. He doesn't know anything. He's not conscious of his environment. So for sociology, that one we say, yes, he has a mental illness. In other words, he has a mental injury that is severe, is very chronic, that we need to take him or her out of that environment so something doesn't harm him or her, because he's not going to harm himself. Now, another thing we have to understand about for social forensic psychology is that people who are mentally ill, and I know I'm with the mental Polk County Mental Illness Coalition Commission. Actually, I've been there for almost over decades. And one of the discussions we always present to them is that mentally ill people don't commit suicide. And people find it difficult to understand that model theory. We say that because we say people who commit suicide are very conscious of their surroundings. They're in pain. They understand pain. They know what pain is, and they're feeling pain because they are aware that either they have been cheated or done injustice to. A mentally ill person hardly understands what justice or injustice is because he's not conscious of his surroundings. He's just there. So this is what criminologists do. And that's why a lot of the time when somebody goes to court and plead insanity, 99% of the time, the jury may not buy it. And if they bought it, they will just send them temporary to a psychiatrist, ward temporary, to educate them, to try to find out. Sometimes they are not really educating them. That one secret of forensic social psychology is that they're trying to observe him in the real in his natural setting. They're trying to observe him, whether he's pretending or not pretending, because the assumption is that people pretend to be what they're not, to get away with things. So you put them there, you observe them. And there was a study by, I'll have to spell his name, this psychiatrist, renowned psychiatrist from New York, Thomas Szasz, I think Szasz, Szaz, Thomas Szasz. He wrote a lot of books about what I call the involuntary imprisonment, involuntary incarceration, that where people are assumed or interpreted to be mentally ill and they are sent to the ward, but they may not be mentally ill, but they are forced to. Sometimes the court impose that sentence. It's not because the person say, yes, I am. It's just like they say, well, we think you are mentally ill. You need help. You know, we hear the word, you need help. We need this thing. We need, so it's a very common culture here. You need help. You need help. When they say you need help, that means you have a mental, you need a mental disease. You need to go and see a psychologist. That is what we call subjective interpretation of human behavior that label them sometimes for life. So the mental is triggered. It's not sitting there, it's triggered. Unless, again, the brain is damaged or is injured.
Okay, I'm coming back to that, but Dr. Alu asked a question in the chat box. He said, thanks first for your insightful presentation. Then he asked two questions. What is your sociological prescription for treatment of people that are temperamental? That's the first question. And the second one is anger a mental illness?
Good. Anger is the first question. How do you treat mental illness? Is education. And
no, it's not mental illness. What is your sociological prescription for treatment of people that are temperamental?
They are what?
Temperamental.
Okay, they are temperamental?
Yes.
Well, again, we have to find out why they are temperamental. As I said before, there's this enzyme in our genes. That's what I call the genetic environment. So when people come in contact, interact with people, if that enzyme, according to the biosociologists, if that enzyme is low in them, is not in the state of equilibrium, then they have tendency to engage in erratic behavior or easily irritated, a very little thing. And so we are looking at the temperament, okay, he has temperament, he has a temper, he has other, but we have to look at what is causing that. So we need to diagnose him. And now, I would admit, I don't think that we have started diagnosing people's level of oxidized or MOA in human, which actually is responsible for human behavior, especially in criminality. Well, all behaviors that are antisocial can be described as criminality or deviant. It's just like, it is criminal when you get caught in the law, but it's deviant basically. So in that one, we have to do the study. We have to engage in study and say, why is he so temperamental? Why? Is it the situation? Now, if it is the situation, if it, people don't always share everything with other people, what they are going through at home behind closed doors. So when they come out, they tend to bring that experience and relate. It's like what we call trauma, right? So a traumatic person is reliving a past experience that was not good. So anything close to that takes them, if I can share. And I was talking to my brother last night. I'll tell you a bad story. He told me he went to the hospital to see a family friend whose son was attacked by a python, a big python. They rolled him around, and so and there was another guy there that came and tell him, take a stone and hit the head. He was doing a goat herd. He was goat herding. So he said, up to now, this guy is not even able to talk. He's always shaking. And you can't touch him, right? Well, that's the trauma of that big snake rounding him, striking him out and trying to kill him, to swallow him. But God so kind, there was somebody that helped him. So that's a trauma that when people go out of the house, whether it's a husband and wife, they had an issue, a child has been abused, and they go out. If they have a lower level of MAO, then if you say something that offends them, they are more likely to get angry. And therefore, they will respond negatively, right? And also in the situation, but that's why sometimes somebody comes, someone you know for a long time, and then one day he's acting and say, what's wrong with you today? His behavior changed. Why? So it's a sudden change in behavior. Well, it might, for sociologists, there might have been a preceding experience. And sometimes they don't want to talk about it. Now, some people, so sociologists say, well, talk about it, interact with people, share what your bad experience. In terms of anger, again, anger is a trigger. It's a symptom. It's a symptom. It's not a condition. It's a symptom. It's an express response to something. So how do you treat it? We go back to one, moral engagement. Some of us, those who go to church sometimes, that's why I like this psychologist say, with the decay of moral religion, or the decay of religion comes the decay of morality, right? We are trained. You can either be trained to respond to certain situations well, or you can be given, if this is available, that enzyme to balance the brain, mind. So anger is part of life. It's more like, how do you respond? Do you get angry and hurt somebody, or there's different stages of anger. There's an anger that makes you want to harm somebody. There's an anger that something's happening that you don't appreciate. So we have to also differentiate those types of angers. But it's a trigger. It's not a condition, it's a symptom. For sociologists, we look at it as a symptom. That is why we say people meet, they are in quote unquote in love, we like each other, everything's going well, the first few months, week, years, then boom, something changed. And we want to kill each other, right, in a relationship. So you look at it that way. So in other words, situation change. And that sociologists call it corrupt, the corrupt culture. We have a corrupt culture also. Corruption can change your behavior towards that may annoy the person you are with or may make them angry. So all those anger, either depression, anger, all those for forensic sociologists is a function of situation, not something in itself. I don't know whether I answered the question, but that's what I'm saying. So anger is not something that is in human being, but it's something that is triggered. And we have to find out how to avoid it. If it's something that you do to somebody makes them angry and they tell you it makes them angry, then the best thing, one thing you do is what? To stop doing it. If you stop doing it, then you'll be fine. But if you keep doing it, then yeah, you'll always be angry. We look at it that way. It's the same with happiness. We make people happy or we make people angry. I mean, that's a dichotomy of life, according to sociologists. Yes.
So, Sister Ellen Toppin agrees with you. She says anger is a behavior that is demonstrated as a result of a situation. It could be controlled. And she's right on the money.
Mm-hmm.
Even though for some people, she said the annoyance could lead to anger. That is true.
Yes.
I would say, though, that while that is 100% true, and the sociological perspective, we disagree with you a lot of times.
I know.
In the medical realm,
Yeah.
it's very true. Anger also can become a mental illness when it is not controlled, when it goes out of control, and somebody just lives angry. It becomes an issue.
Well, yes, again, that's what I say is you can call it a mental illness, but for sociologists, a mental anguish. It's not an illness. It's like a trigger. Now, it creates anxiety, and that anxiety may lead to, if this not treated, and I understand what you're saying, that's what I'm saying, so you have to stop doing it. If it is not treated, that anxiety result into depression, one, and the depression may lead to a suicide, or it may result into anger, and that anger may result into homicide. For sociologists, we look at it into two dimensions.
Mm-hmm.
One may lead to this, and the other one may lead to depression. Then people start doing drugs or engage in just isolate themselves and then commit, and at the end, they just say nothing about life, they commit suicide. Or the anxiety get them so angry at the person that is doing it to them that they decide that the best way to settle it is to go and harm the person. And that, for sociologists and criminologists, we say that's what results into homicide. So yeah, but mental illness sometimes, that is what it gets into temporary states. It gets so high up temporarily, and then when you commit this, especially the homicide, that's when they start looking at, I should have handled it that way, but it's too late. So yes, the anxiety can drive them into because that person you are. The thing is that the reason that you are angry and your anger lead to violence against person is that you now look at that person as you demonize that person also, and then you look at it as a monster who is really wanting to harm you, and you are saying that I'm not going to take it. So really you are making a conscious decision. So it's not really, you can call it mental, it's a mental state, but you are making also a conscious decision to harm somebody as a way to get even for what they're doing, the pain they're causing you. So really you are conscious. You are not, I mean, maybe you lose, people say temporary insanity. No, you are not unconscious. You are conscious. When you pick up the gun and say, you go to the room and shoot somebody, you are conscious. You knew that you are there to harm the person. It was not that you are unconscious. No, unconscious people don't. Again, it's in the criminology, we call it the actus reus. There's the actus reus and there's the mens rea. The actus reus is the conscious state, the acts that you do. The mens rea is basically the intent. So can you form intent? That's the idea. If you are not conscious, can you form intent?
Okay.
So this is what it
Thank you.
is.
So before I go on, because there's a switch that I'm going to go to from the messages in the chat box, I'm going to call on our sister Ellen Toppin. You have your hand raised. Kindly
Yeah,
unmute.
can you guys hear me? I'm not sure if
Yes,
my
yes,
video is on, but if it's not, you
we
can
can
hear
hear
me.
you. We can hear
So,
you.
so Professor Baba, I don't know if I'm saying your name correctly.
No, don't worry.
You you have touched on many, many, many things which impacts our society. And I'm gonna ask a question, then I'm gonna make a comment.
Okay.
I'm gonna go with a comment first. It might provoke discussion. I hope it does.
Mhm.
You have psychologists seeing anger one way. You have psychiatrists seeing anger another way. You have the human rights advocates seeing anger one way.
Mhm.
I am angry because you are oppressing me.
Mhm.
My anger is as a result of something that's being done to me.
Exactly.
That anger, if the oppressor stops oppressing me,
Mhm.
is eliminated.
Exactly.
But if the oppressor continues to oppress me,
Mhm.
my self preservation kicks in. And
Mhm.
I feel I have a right to defend me
Mhm.
or my community or my family, whatever the case may be.
Yes.
And I am not mentally ill
Thank you.
when I take up arms and defend myself.
Mhm.
I am mentally capable of defending me because I understand what is happening to me. Now, I'm not advocating that the person should do harm to another person. But
Mhm.
what I'm saying in our society,
Mhm.
when I take up arms or resort to violence, whatever form it might be, it's not because I'm mentally ill.
Mhm.
It is because you continue to harm me, either physically or psychologically, economically, or otherwise. And therefore, I feel that I have a right to defend myself and I cause harm to the thing that is causing me harm. So I'm not, the annoyance that has occurred has pushed me to anger and it doesn't correct itself. So I take action against the source of the annoyance. I'm not mentally ill. I'm capable to differentiate and to understand what's happening to me. So that's my contribution. And hopefully we hear from some other people, they might agree or disagree.
Well, I think that's exactly what I was saying. That's why I said people are conscious because I think I mentioned alienation. As I said, when people are alienated, there are two ways they go. Yeah. The reason people may we have to also for social forensic psychologists, we look at who is actually doing the label. We label people based on the power we have. Who has the power to label people? Most of the time, the powerful people label you the crazy one. You're right. So it's like I know it's a controversial issue. It's like who label who is terrorist? Who is a terrorist? It's the same thing. If I defend myself, I'm a terrorist. But if you are bombing me, you are not a terrorist. So that's why sociologists say we have to look at label. And we need to understand the stigma and be aware. That's why I said there was a need for understanding how the cultural dynamic of diagnosis. People are diagnosing you because they don't like that. You are trying to defend yourself. You're right. You have been oppressed, and the idea is that, well, you just, take it. And if you don't take it, then you must be an angry person. But that's what I began. I mean, I mentioned that anger is a natural response of a human being, just like happiness is a natural response of human being. But I do not continue to be happy. But I'll be happy today when I was watching soccer yesterday, the finals, and not offense to the people who are for Argentina, but I was happy when Spain win, and I just get out there. All of us get up, and we were happy. Now, if they had lost because we were cheering for Spain, we will be a little bit, depressed. We feel bad. That's what it is. So it's the situation. So you are 100% correct, and that's why I'm saying that sometimes the culture is very, very important, because what happens is that some things are institutionalized, right? And because they're institutionalized, then there's a need to control certain people, right? So if I want to control you, the best way to control you is to label you. And most of the time it's negative. It's what sociologists also we call self-fulfilling prophecy sometimes. Sometimes people act on it, on the label. Some people defy the label. And that's why I tell my class, I don't believe in the gifted or ungifted children. I believe that children who are is about discipline. How you discipline yourself, you do well. You become whatever you want to be. Not what you want to be, but you will do something if you discipline yourself. But who label people gifted and ungifted? When you look at the gifted, they are always in the high level echelons of our society. So it's a game. We have a game of label. So the oppressed are supposed to take their oppression without resisting. And the oppressor is the one who is defining you with the help of the elite, academic elite. So that's why sometimes you hear the Harvard researchers say this, or Yale researchers say this, or Stanford researchers. Why? Because they are all they are the one who label the powerless. So, and that's what sociologists are saying. So human beings react. Rich people commit crime, just like poor people commit crime. Rich people, in fact, I used to do domestic violence. And you find out that, in fact, domestic violence is more prevalent among the rich and the people, but is underreported. But in the poor, it's easy to label you, report it, and label you so accordingly. So, 100% agree with you. But I'll be glad to listen to your question.
Okay, so before I go to my question,
Mm-hmm.
I just want to posit there's a difference between disappointment
Mm-hmm.
and anger. If we lost, for me, if
Mm-hmm.
we lost, if Spain had lost yesterday, I might have been disappointed.
Yes.
But the action I take of my disappointment did not harm anyone.
Right.
So I may not have been angry, I would have been disappointed.
Exactly.
So with my question is, what is the difference between a substance use disorder and a substance induced disorder? And part B, what is the real difference between a person who is schizophrenic versus mentally ill?
Again, for sociologists, we come from the ideas that it's just a label, it's a label. Everything is about label. And the people who do the labeling, people who have power, it's a power. So there's something in social science called differential labeling. So the differential labeling basically is we choose to label certain behavior describing the medication by those who are evaluating behavior or psychological behavior, psychic. I said they are not differently from priest, from priest, right? Because priest used to say that you have a demon that we need to cast, we need to pray for you to get it. So we sociologists actually, and I know it's psychologists may not agree with, so we look at psychologists and psychiatrists coming from that angle, that the priest is the one that tell you when you have a demon or you don't have a demon, or when you are saved or not saved, or when you have reached the Holy Ghost or you haven't come to the attend a certain level of the Holy Ghost, because it is it becomes his property to use to label you. And when somebody labels you, they control you, basically. So when they control you, they can oppress you with the help of the institution, like the criminal justice system. There are people who resist going to a certain program, but the criminal justice threaten them and say, well, if you don't, then we're going to take away your child, we're going to lose your employment. So people are forced to go to a program that really they don't need to go, just because they exhibit certain behavior that somebody does not agree with, or it's not your norm, it's not into your culture. And that's why the culture comes. So in our African or Nigerian culture and American culture is not the same. So when you look at the rules in the United States and look at the rules back home, they're not the same. So the culture determines how we define whether you're something called schizophrenic, bipolar, mental. This all terminology that's used. That's what I mentioned, that if you look at the DSM, you will, there are about over 400 concepts that define mental illness. So that is why sociologists say, what, this is why, because it is subjective. So all those terminologies are subjectively defined. Now, do people go through situations that drive them crazy enough to in level of trauma, or yes. Do people dream something? They can have a bad dream that you wake up at night and scream. Yes, that is part of human behavior. But what happened that sometimes people label it as it's an illness. But then there's really the treatment comes back to either you medicate or you continue to see the psychiatrist. But the dream, the act doesn't stop. It may or may not stop. It may temporarily with medication, because medication, I mean, I know I'm not a medical doctor, but medication is for when you give it that, it control the nervous system, the anxiety. Some of the medication are designed that way. But for sociology, we say that it destroys the immune system. the natural immune system. So some sociologists are more likely to be against medicating somebody. So we will recommend, again, talk to the person, talk to our neighbors, talk to your friends, talk to your relative, or remove them from the environment. Like a young people, we're talking about young people, while the young man getting a mental illness, is he been abused at home, then we remove them from the home. That's why we have foster care, right? Foster care is a clinical sociological endeavor that, okay, you have been abused or you've been neglected, so we take you to give you a good environment that you can grow, you can be nurtured. So I don't see those are just for sociologists, and I'm a strong believer in that. And just like Thomas said, actually, if you read him, he would tell you a lot. Those are terminologies were created to just label people. It's a labeling terminology.
Well, we don't, uh, uh, Baba-Sanghri, I disagree. I have
I
to
know, I
come
know,
on.
I know.
When you look at the DSM criteria, the DSM um, that you alluded to in your conversation when you were presenting, we have guidelines. There is indeed mental health. And I'm very glad that your title today actually talked about cultural aspect. It is culture and the stigma. You sociologists have stigma against mental health. You do, clearly. And the stigma is what is now causing you to not even want to address it, to disagree with treatment. We diagnose mental illness and we treat them and stabilize people. And when they get off of their medications, or if they get off of their medications, they run into trouble because then they cannot control self. Now, you rightfully mentioned um, possible causes of mental illness. It could be genetic, you're right. That's why, for instance, when somebody has depression, one of the classes of drugs we use to treat them is serotonin inhibitors, where um, we use that to treat. And if the problem is serotonin related, guess what? They become stable, they become normal again. The depressed mood and all of those symptoms, actually resolve. And they can live their lives just by taking that one pill a day. There is schizophrenia, what you described. I actually wrote this down. I'm sorry, I could not take it anymore. I have to interject. You sociologists, I mean, medical doctors just don't like you. You said um, something about life experiences and genetic. I actually put life experiences can induce mental health issues if right intervention is not had, and especially if somebody has underlying reasons to have mental health issues, and so they would develop it. But right diagnosis and medication helps. You said something that I wanted to say, that um, mental illness is when somebody don't know what they're doing. That is somebody who is mentally ill will not know. They cannot control their behavior. They will not know. Well, I disagree also, because mental illness involves a lot. It could be anxiety, depression. It could be personality disorders, like somebody who is histrionic, or somebody who is, you know, I don't know, many personality disorders can occur. in mental health, as well as, other mental health disorders that you're alluding to, like psychosis, full-blown psychosis. So you cannot just lump that it's when somebody don't know what they're doing, that's when they have mental health illness. And I want to encourage everybody on this platform, if you're having certain symptoms and you're diagnosed as having mental health disorder, please get treated. Don't listen to sociologists who think you should not be treated, because they are totally wrong.
Well,
Uh,
okay.
it could be chemical imbalance in the brain. It could be environmental issues. It could be exposure. It could be like you alluded to, domestic violence. It can induce a lot in people, and so you got to get treated.
Well,
Don't.
I'm not disagree. As I say, the idea that mental illness, when we say mental illness, the sociology is that we are mental being. We are a mental being.
May I say something also? I want
Yeah,
to say that everybody has a degree of mental illness. It's a degree.
That's right. That is
Thank
correct.
you.
Everybody has it.
Everybody.
How do
well,
you manage it? What it
but,
is?
but
Thank
it's
you,
not
Madam VP. Please let her interject here.
okay. Okay,
Everybody does.
okay.
Go ahead, Madam VP.
Yeah, we all have anxiety producing behavior.
Exactly.
Everybody has it.
Yes,
One person can be looking for their key and they just go off. Everything just go upside down just because they can't find their key. You
exactly.
understand?
For that
Just
moment.
yeah, just that. It doesn't mean that there's no human being that's 100 perfect. It's how you manage your inadequacy. That's what happens. Whether you're getting support, medical support, whether you're getting emotional support, whether you're getting counseling. A lot of people go for counseling. A lot of people go for therapy. A lot of people go for different things to regulate themselves. A lot of people are on pills. It doesn't matter. What is important is you show up 100%. And whatever that means is what it means to everybody. But people that are not able to control their behavior or their conduct, that need clinical support, that is another level. Do you want to know how many of these CEO, how many of these senators and congressmen are on medication? You don't want to know. And we
Exactly.
see some of them play up on TV. We see them on radio. We see them go off.
And
You
the
know,
question is why? Why are they on medication? That's the question that sociologists
yeah,
ask.
It
but
could be,
whatever
it could
whatever
be
they
any
need to
reason.
balance, yeah, it
You
could be
look
for
at you
whatever
look
reason.
at okay, the treatment is the question of sociologists because these senators are go through a lot of stress. There's a
Mhm,
lot of stress. There are
mhm,
there
Okay,
are
Baba, that
uh,
is what we look at. We
mhm.
right.
actually look
But
at
the
the
stress
cause.
is it what I'm saying that the stress is a symptom, it's not the illness. Stress is a
It
symptom
could
of
be,
something.
but
So,
how
Yeah,
they
there
how
are so many stressors, though. There are
right.
so many stressors. How you are able to manage your stress?
how
Some
they
of them,
manage it. Thank
yes.
you.
It's true,
Becomes
but
the
then
issue.
when you are giving people medication, what we for social that we want to uniform everybody to behave the way we want them to behave,
No,
rather
no, not
than
at
looking
all.
at people respond. No, we are saying that people respond, yes, different to the situation. Remember, I started with saying there are your level of MOA or monoamine oxidase
Yes,
can determine how
monoamine oxidase,
so it
but
can determine how
monoamine
people
oxidase.
respond. Right.
We get it.
So yeah, so people can respond differently to different situations because of that genetic or that thing in our system that's supposed to maintain our level of equilibrium. We need a higher level of that. So if the treatment, that's what we're saying, if the treatment suggests that based on your finding, if your finding is that that level of enzyme is not enough to maintain your equilibrium, then yes, we need to
Baba-Singhri, that is a
Right.
small, that is a small
When we are, no,
proportion.
no, listen, so when we are saying it is a social interaction that I'm interacting with you, you make me mad. You say something, it makes me mad. The other person doesn't find it funny. You find it funny. That's what life is. But it's nothing, or I get angry at something and you don't get angry at something does not mean that I have a mental illness. It's just part of how humans are. So we are, but when we run to, okay, well, yeah, he's exhibiting some angry behavior or self, or let's give him medication. Medication doesn't help. Just like you said, you just alluded to that. You give them medication. When they get out of the medication, they go back. They fall back. In fact, it gets worse.
Medication helps. And
Well,
some people,
it's a temporary fix.
actually not.
Yeah,
It
it is a
helps,
temporary
it
fix.
helps to stabilize, and when somebody needs it, they need to stay on it. But Baba, we have a lot of
It's a
questions.
temporary fix. That's why we are
We
dancing.
have
Yeah, but it doesn't matter whether it's temporary.
But it
People,
matters because
no,
it gets people into a situation where it's like for sociologists, our theory conspiracy is that it's a pharmaceutical company making money out of
See,
people.
that's the thing. You said it.
Yes, it
Conspiracy
is.
theory.
They are
What
pushed
you
by,
have
they
is
are pushed.
conspiracy theory. You said it.
yes,
It's
I
not
didn't
a,
say
yes.
it.
it has been proven even by some, in fact,
I did not say it. You said
yeah,
you sociologists say is, you call it.
yes,
It's
yes,
not,
and I think that a lot of even the FDA directors and some again a lot of medical doctors and some psychiatrists now are coming out and saying yes, I think it's very damaging to people, especially children, when you start
actually
giving
not.
them early age because it destroyed the natural immune system. That's what
Yeah.
No,
You know,
heck
Baba,
no.
Dr. O,
No,
just 1 minute, please.
no, it
Dr.
doesn't.
O,
it does.
please, 1 minute. Baba,
Yes.
let me tell you something. You know, in Nigeria, Southwest Nigeria, in Lagos, we
Uh,
have a mental house, which is in Yaba. It's called Yaba. Once
mhm,
people tell you that you're going to Yaba, that means you've lost it.
mhm,
However, do you know, I mean, statistics from what was reported to me about 5, 6 years ago,
mhm,
90% of those people receiving treatment are those who went through marital trauma. They were all 100% okay before they got married.
mhm.
90% of the people
Thank
receiving
you.
treatment did not have mental issue.
Thank
But
you.
guess what? Because they are there, people
Mhm.
already say, oh, you are, we have a way of stigmatizing people. And that's what hinder people from getting the help that they need. We say they're crazy. That's the way we call them, the African
No,
people. Yeah,
no, no. Okay,
And that's what sociologists do.
no, no, okay, see,
And you've got to
it just says
stop
something. It just said,
sociology.
no, it just says
No,
something.
don't say something. I want to call
No,
on
no,
the
no.
next question.
No, I want to respond to her. She said something very important. She said 90% of the people didn't have a problem until it was a marriage. But sociology will say rather than taking them to a psychiatrist ward, you educate them, you have them talk to their family. The reason that we take people to psychiatry and put them drug because the family culture has broken down, whereby people don't interact the way they used to. We don't share the way we used to because
Actually
society
not.
has become very individualistic. So
Prof,
everybody keep to himself. And that's
Prof,
why I
Prof,
believe
no.
you're right. The marriage cause problem. Yes, it's a social situation that caused them to become crazy. Yes,
Prof,
yes.
no. Actually not. We actually,
I
when we
just said
treat,
it.
we get counselors. We have counselors, we have therapists, and they're very busy these days because there's a lot of mental health because of what is going on in the world today. But guess what? We have counselors and therapists that actually get to talk to. But Baba, because we have to go on, I have lots of hands raised,
Okay, go
and
ahead.
I have Sister Mudukpe Aramide all the way in Nigeria who has posted a question um, over 40 minutes ago.
Okay, sorry
Um,
about that.
it's in the middle of the night in Nigeria.
Yes,
So
more than that.
all of you who have your hands raised, I'm going to call you in a minute, but please let me just quickly read out this question
Okay.
because it's from Nigeria. She says, well done, sir, for this session. Please, sir, is ADHD a mental illness? That's the first question. I just want a yes or no for that one because somebody had said you
No,
mentioned ADHD. No,
no, no,
ADHD is not a mental illness. Thank
no.
you. Thank you. The sociologist got that one right for a change.
Okay. Uh-oh.
ADHD is not a mental illness. Now, there's another,
Hallelujah.
yeah, hallelujah indeed. You got that one right. But she has a follow-up question. She said, and how do one handle an environment that constantly triggers a kid with ADHD and in a place where diagnosis and treatment is almost absent? How do one handle such kid and make them thrive against all odds? I'll answer that question because it's a medical question. ADHD is one that you're right. We need professionals who know how to manage the outbursts and decrease the triggers. When you put a child with ADHD in a place where they're triggered, they're going to have outbursts. So what you can do, especially in a place where there isn't much on ADHD, and I bet that is Nigeria, trust me, some of us are looking into bringing stuff that would assist with this because there are more, we're getting more and more diagnoses of ADHD in the country. It's important to understand the triggers of this kid and remove them from it to prevent it and give them structure. Structure is very important in ADHD, where they have a routine. They know exactly what to do daily. They actually are very intelligent, these kids. It's just that the social aspect may be lacking sometimes. And in most times, the social aspect of life and also speech for some of them, where speech therapy may be needed. So structure is very important. Routine is what I mean by structure. They wake up at a certain time, eat at a certain time. They do the daily activities you need them to do and don't limit them. Let them be exposed like other kids. Um, and they go to bed at a certain time. Structure
Can I
is
drop in a
good.
couple? A
Yes,
couple.
please. Yes.
Yeah, people with ADHD, they are very active. So you cannot constrain them and sit down there. Why are you always moving? They need to move. That is the way their brain are wired. So you have to provide an opportunity for them to keep moving. You can send targets, whether okay, you are going to walk 1 mile to go and get me that stuff, so that it makes sense to them what they're going to do. It needs to be consequential or productive. Like Dr. O said, what is their trigger? For some people, it's excessive light. If excessive lighting in a room, they don't like it. For some people, it's excessive noise. If there's too much noise, some of them may need to wear hearing aid. So you need to know what is it that trigger, because especially when it comes to noise, it's like putting needle in their brain. And then they will just, especially, or maybe there's commotion in the house, you will see them put their hand on their ears and say, they want to just get out. So you cannot constrain them. They need to move. By nature, they want to move. So rather than focusing on the deficit, like Dr. O said, they are super intelligent. So you need to challenge them. You need to give them things that they should do. Give them activities and have, what do they call it? Like a pre-mark principle. Reward them for doing something so that they're excited to do that thing. But let it be something that makes them move. They need to be on the move. They want to move all the time. Don't restrain them or constrain them. Thank you.
Well, I think that was one of the
Thank you so much.
that's one of
And no, Baba-Sanghri, 1 minute. Dr. Fawole, she's an expert also at this. If you please unmute, and I know she wants to comment on the ADHD before we lose that.
Yes. Thank you, Dr. O.
Thank you.
I I just want to comment on the ADHD versus autism. So for ADHD kids in Nigeria, since there may not be diagnosis, but you were able to identify that as ADHD, I
Um,
think it's important to, oh, can you hear me?
Yes,
yeah,
we can hear you. We can hear you.
So
Yes.
it is important to identify the symptoms. Because ADHD affects concentration for kids. They have a hard time concentrating. They might start a project, they will not finish. They have challenges with time management. They can get also they might get angry at the least or the minute things. They might get angry at it. They forget things a lot. And not because they want to, they might do homework and don't submit it at school. All that are the symptoms of ADHD. So, and just like uh, Madam CEO just said, they need to be active. So my son had ADHD when he was younger. Before he goes to school, he will climb the staircase in our house 10 times in the morning. And that helps him to burn the energy. And I would say, so that can be something. However, it works for the child. So with forgetfulness, you might have to do like color coding, depending on the age, color coding or the work that they have to do at school, so that or everything reading is blue, everything math is yellow, something like that. So just to kind of help with the organization, because they struggle with organization, they struggle with concentration. If you give them like 2 step direction, they might not be able to go through it. So there are different ways that you can do that if that is a prevalent symptom. So you can give them 2, you start with 1 and then go to 2, but you have them to repeat what you want them to do before they leave you. So that can also help. And work with the teachers. You can do like parent-teacher communication on a daily basis. And reward is very important versus punishment. You might tend to want to punish them, but punishment doesn't work for them. But reward them. Natural consequences is better than really punishing them for whatever they did wrong. So reward, reward, reward. It doesn't have to be something big. It can be something very small that you will reward them with. Even as small as stickers, as small as edibles. And on top of that would be the diet. I would say, focus on the diet so that they're not eating a lot of sugar and they're eating a lot of vegetables. That will also help their brain. I guess let me stop there.
Yeah, no,
Yeah.
don't yet. Before you stop, please,
Okay.
keeping autism a difference, because there's a question on autism, so we knock that out too. And autism is not a mental illness. That was a question that was asked. It is not a mental illness.
All right.
Yeah,
ADHD, autism are not mental illnesses.
they are. They
They
are
are
not
mental
mental. They are
illnesses.
not meant. They are not mental illness at all.
Okay.
They have to do. They are really no neuro
Divergent.
divergent.
Yes.
So it has to do with the brain. And autism, sometimes it exists with ADHD. Sometimes ADHD exists alone. But most people that have autism may also have ADHD. But autism by itself presents with the social skills. They're the one that lack social skills. Kids with ADHD, they don't have any problem with socialization. But autism, they're the one that have challenges with social skills. They have challenges with communication as well. So if it is autism, depending on the age, I would say the same thing. The same strategy can apply, but some slight differences. But we also know that autism is on the spectrum. So depending on where the child falls on the spectrum. So I always advise parents, just know your child. Know what are the challenges that the child faces and know the strengths. So once you find their strengths, we use the strengths to actually compensate for the challenges. So we want to be particular about their strengths more than their challenges. So whatever they lack, then we find accommodation to support that. So if there's a child that is struggling with echolalia, maybe they just repeat or they don't have language, expressive language, then we have to accept other forms of, of communication. And that can be gestures, that can be sign language, that can be using maybe AAC, like augmentative form of speaking. So whatever is available to the child, we all have to accept that so they can communicate. So whatever the form of communication is. With the social skills, yes, Dr. Ho knocked it on the head. We do not want to limit this case. We really want to expose them as much as possible so that they have experiences as well. And I know it's tough. It's hard to do for parents. But, you know, one step at a time, one thing at a time, we just keep going. And I'll say, join a support group, even if it's on Facebook. And that will also help the
Can
parents.
I respond to some of this? The people are talking about the solutions. I think one of the biggest issue that we have, and sometimes we pick up different theories and different writers saying things and we put it there, is that we are trying to figure out the diagnosis, whether something is diagnosed that is not there, not whether we treat it how we treat it. We've been talking about what we can do to help. I think that was, as I said before, I mentioned earlier that some back home we were raised very active, going everywhere and active. In this society, people are constrained, and young people are constrained, so they have a lot of energy to dispense. So that's why we are saying that ADHD level is not for them. But the question is, how to
No,
know what really are the causes, not what we can treat it. We will know how to treat it if we know what the cause of the disease is. But if we are not just saying, well, this is how we can treat the disease, because somebody has written something how to treat it, I think that the biggest problem that according to sociologists see is that we rush into, okay, let's give the treatment there for somebody, donate money, okay, give us money, we will treat it because so it becomes for us, for sociology, it's not about what are we diagnosing. It's an interpretative thing. It's not a scientific diagnosis. There's no scientific diagnosis. You're looking at a pattern that one forensic pathology will look at it and say, yes, is there? Another psychiatrist will look at it and say, no, it's not there. So we have to be aware that it's subjective. But we also have to.
so it is not.
Every,
Baba-Sanghri, we're talking about ADHD and autism. These are mothers on the
every
platform, and it's
human,
not mental health. So we
human,
deviated a little bit.
yeah,
We're
human.
going to come back now to the
Let's
mental
focus
health
on
part.
what it is not. Let's focus on that, not how
Yeah.
we treat
Okay,
it.
so thank you so much, Dr. Fawale. I was going to thank you, appreciate you for that input. And I'm sorry, I was answering ADHD and autism, and I'm glad you nicely separated them because I saw both questions and I wanted to tackle them
Yeah.
since they are not mental illness, but they are very important to answer. And I know that we have a lot that we needed to say on the mental illness. Madam VP, did you want to say something about autism and ADHD or?
Yeah. I mean, like Dr. Fowler said, autism is on a spectrum, and some of the behavior exhibited may look like HDAT. The thing is that they're both energy driven. Okay, the HDAD, they're very physical. The autism people, they're mental, they're always thinking fast. They can outsmart you even if you're not careful. The mental, their energy is driven mentally. So, and she also mentioned about food as a reward. They thrive highly on dopamine, so they love food. You have to be careful about what kind of food that you're giving them, because you will see most of them physical characteristics of being on the obese side because they love to eat. So one have to be careful what kind of nutritional habits that you give in the house. Let it be something that maybe a lots of fruits. Lots of fruits. Some of them have sugar because they love sugar. Everybody loves sugar. Thank you.
Thank you. Thank you so much, Dr. Fawale and Madam Lara Okunobi, for sharing your expertise. And thank you for taking care of children in that spectrum also. We appreciate you. Thank you. Bridget Nkechi, kindly unmute and ask your question. Thank
Yeah,
you.
good evening, everyone.
Thank you for your patience.
Okay, yeah. I just wanted to chip in some things. And I also wanted to let you guys know that everyone know that I agree with the professor in some of the things that he says strongly. Mental health is not for everyone. It's not, sometimes it's being misdiagnosed. I'm going to use myself as an example. I was dealing with domestic violence for so long. The professor said that the abusers use mental health to control the individual, their victim, which I had experienced in several ways because the person that was abusing me was trying to hide his behavior and would just do things that just happen that he does between just me and him that I cannot share with other people. But the minute I share with other people, they see it as if there's something wrong with that person, right? And they wanted to force me into taking medication, into going to see a psychologist, to see someone, but I had to withdraw myself from not doing it because my abusers know that if he labels me with that, and he's going to really place me in a box. He already placed me in a box. I will give you guys an example of how an abuser would make one feel that that person is mentally sick indirectly, because it just happened to me recently. And I've been monitoring that, but I just confirmed it. I do research on myself. So my situation was when I ran away from my abuser, I ran away in May. And in May, every month of May, the first week of May, I noticed that my abuser would do a lot of things that would trigger me talking, trigger me calling on people, have a lot of anxiety. But on my own, I had to start curtailing my behavior because I know I don't have anyone that could speak for me. That I had to stand up for myself by controlling my behavior because he would do things and I would start crying. Seriously, I can't even express myself. So this year, May, I was prepared. How was I prepared? I said, this May, I am not going to call on anyone. I started breaking myself away from it. and and now I know his magic. Now I know what he does. You understand? So I was ready. So May, the same day that I ran away from his house, you understand, I was doing something and somebody keep appearing and showing like a shadow. And somebody was actually there. But the mistake I did was I didn't have my cell phone, you understand, to record. But you understand, I was shocked to see that thing happening again. So what I did was I had to now say to myself, I am not going to call anyone. I'm going to be strong and I will not give in to this. So the next time I went to the same place, I was prepared. I had a camera, I had everything to take record, and I never said anything. So when he did like 2 or 3 times, you understand, and then the third time that they noticed that I had a camera, they did not do it again. So what I'm saying is sometimes a psychology will see whatever that I'm telling them as like she's seeing things.
Yes.
You understand? She's mentally insane. You understand? I had never taken any medication. And then the professor also said changing the environment. Changing the environment does help too, and having listening ear. Let me say this too. When you all in this group, as Dr. O, Madam VP started listening to me, that I could see people that could relate to me. Look at me now. Did I take any medication? Did I have to do anything? I know I'm smart. I know I can do things. You understand? But that person that was doing those things were trying to prevent me from doing it and trying to suppress me. And when you suppress someone, that person will start taking medication. I remember when I was living in Maryland too, they were trying to give me medication. I noticed that the medication was making me feel slow, was making me sleep. What did I do? I started throwing those medication away. You understand? But he's the one mentally, indirectly, directly abusing me and mentally abusing my brain and making other people around me feel that she talks too much. She doesn't know what she's doing. So not that even the psychologists were, on one way or the other, siding my victim, my abuser. They were not looking at it from the other side of me, because they do things secretly to trigger me to talk, to trigger me to do things, to trigger me to yell. Like that night, if I had yelled and, oh my God, I called the police will come and say, oh, we didn't see anything. She's mentally sick. And I'll be forced into the mental home. So it's not everyone. It's not everyone. When the main thing for us is to listen to those people that are going through what they are going through. You're not wearing their shoes. Because when my abuser or my stalker was doing what he's doing, he doesn't do it with a third party. He does it with me. I see it. You don't see it. So it's good for us to listen. And it's also good for whoever that is a psychologist to listen. Don't prejudge me. Don't be biased. Because you didn't experience it does not mean any other person would not experience it. So that's what I want to say. Yeah, mental health, yeah, it does happen. Yeah, to some people. But what triggers it, or what happens? What is that really caused that? Not everybody, like Dr. O and Madam VP said, everybody has some kind of mental illness in them, but not the one that you talk too much, not the one that you repeat the same thing, not the one that somebody is doing something and he doesn't want you to talk, but they want to place you in a box and continue to abuse you. Outside, the person pretend to be nice and say, yes, ma, yes, sir, yes, sir. But inside, he's torturing me mentally. And I'm looking at myself like, really? This is happening? Well, but if I come to tell you that, oh, this person is like this, you say, oh, no, he's not like that. He's very respectful. But I know what I'm going through. So that's what I want to clarify. Mental health did not work for me. I was pushed several times to go see a mental health person, to sit down. I tried it once. When I shared my story, they were judging me and I stayed away. If not, I would have been placed in a mental home, or if I would have been injected. So that's all I want to share. Thank you.
And thank you for putting that. That's exactly what it is. The people, according to sociology, those people the abusers are very, very manipulative, very manipulative. And that's why we have to be very careful when somebody label you, because the goal is, if I label you, then I can control you, and nobody will trust you, or nobody will believe whatever you say, because they're in charge. I've seen that. I used to do domestic violence class. The guys, I can give an example. I think I might have given it here before. We treated this guy for after 22 weeks. The same day, he started acting nice and everything. We thought, oh, this guy is cured. And we gave him his certificate that Saturday. I still remember we gave him his certificate. He went outside. The girlfriend had come to pick him up. He beat him up at the parking lot right there, right in that parking lot where we have the education, where he completed it. So we had to call the police to have him arrested. Why am I saying that? So it's the trauma they put you through. So that's why we say education and removal from the environment is more important than just giving people drugs. Drug is the management is never ending. I mean, we have seen a lot of people on drugs for this, for that, for years. It's a management. And sometimes it kills the immune system. That's what I'm saying. So human beings, as long as we interact with people, there's always going to be trigger for you to be either happy or to be unhappy, to be or to be joyful. It's always there. But we can always say, oh, okay, yeah, you're angry today, you are mentally ill, so we're going to prescribe medication. It is very, very dangerous. And that's why society, we see people, these young people, you give them drugs, sociologists have found out, by the time they're teenagers, they start acting up. And because nothing works anymore and their behavior is no longer in the original state where they will be immune to anything. They have destroyed their immune moral capacity. So they behave like,
we still have questions, Baba.
they behave that way. So we have to be very careful with medicating kids. Yeah.
So I have somebody 443, your phone number. Kindly unmute and introduce yourself, please. Kindly unmute, and thank you for your patience because you've raised your hand for long. This is unusual. I'm sorry. We'll try to make our responses shorter so that we can get to all the questions.
Is it the one with 2226?
Yes.
Okay, thank you for honoring me tonight. My name is Miss Paulette Atebak. I think I met you in Blakehurst last time.
Oh.
It's just because I don't know how to put the camera. You can
Camera on.
recognize me. But
Oh.
I'm so
Welcome. Thank you for joining us.
yes,
Thank you. And thank you
enriched
for your
again.
patience.
Thank you. I'm enriched tonight through what Professor just teach us through this Zoom meeting. I have a son who has a lot of diagnoses. They said he has PTSD, he has bipolar and schizophrenia. And my question here today is how, as parents, how, as African, can we detect, like early detection of mental illness through our children? And another question, is mental illness hereditary? Like, can it spread like from parents to children?
Good question. Genetically, unless unless it is if they discover that the part your is the MAO is part of you that was given is difficult too. One of the argument for hereditary is that we hardly know whether it's from which of the parents, where it come from. So I haven't read anything about that, but I'd be glad to do research on that. But I don't know if behavior is.
Can I answer it?
Yeah, it's necessarily hereditary. But okay, yeah, pass it to you then. Yeah.
Okay, thank you. Mental illness can be hereditary. It can. And interestingly, you can see it doesn't have to be the same diagnosis from one generation to the other. And I'll be specific. Maybe a parent has depression and their child has anxiety. It can be genetic. It can also be environmental. You said some things that concerned me, that your son was diagnosed one with PTSD, that's post-traumatic stress disorder. So your son must have been exposed to some situations, some conditions that caused that post-traumatic stress disorder. Then you said he was diagnosed with schizophrenia and bipolar disorder. Please, I would beg and encourage that you seek a second opinion. When I see tons of mental health diagnosis lumped together, I get concerned. Without going into much detail, I would like you to please consider taking your son, I'll repeat, for a second opinion. And please seek an MD psychiatrist so that proper diagnosis can be made and proper intervention can be given. If you don't get the diagnosis right, you cannot get the correct intervention.
What about the VA? Because he was in the psychiatric in the VA. He went to the Marines.
He went to the Marines.
Yeah.
So he's had, I can see where the post-traumatic stress disorder came from. Even there at the VA, you can seek a second opinion,
Okay.
please.
That's why
Because
I'm here today, because as a mother, I've been going through a lot. You see here, I keep going to the courthouse to have the emergency petition, and now my son is in the street since March. Last time he came, he fainted like 3 times 2 weeks ago, and he was admitted to the psychiatric. Before the psychiatric, he was in the intensive care unit because it's like he was out of breath. He was having like apnea. He was out of breath. And he went there for 4 days before they transfer him to the psychiatric. And they freed him. He's free outside because they are saying he's a grown man. He's 28. But he can't decide on his own.
I think the
Yeah,
PTSD, the PTSD can also create anxiety. The trauma.
well, the thing is, he's 28, he's an adult. By law, you cannot make decisions for him anymore. Believe it or not, even at 18, you can't. He has to want to be taken care of. He has to want to be committed
Right.
for them to do that. And you're right, unless there's a court injunction that is a threat to himself or a threat to someone else.
Yes.
It's only under those circumstances that court mandates can be had to keep him in the hospital to treat him. You said we met at Blakehurst. Do you
Yes.
have my phone number?
I have your phone number,
Okay,
and you
text
gave
me.
me a package to collect the DNA, and he refused.
Oh, the gene
That
site
was me.
testing. Yeah, the
He's
gene
saying,
site
oh,
testing.
they will experiment him and they will take him as an experiment again. Like in the military, they are just giving him the medication and it's not helping. He's no longer taking anything and he's
Yeah.
running away and he's
The-
not doing well.
What the gene site testing does, it uses his DNA to figure out what will work for him.
Yes.
And yeah, well, it doesn't want to do that. Um, there are other routes that can be taken. Text me.
Okay.
Let's take
Okay.
it off. We don't establish doctor-patient interaction here, and you are not
Okay.
a patient.
Yeah.
And at least I can point you in the direction of interventions that can be had. It served us.
That's right.
It served us, and now we must serve
Serve
him.
him. That's right.
Thank you. Thank you. I will
So
try.
sorry.
Yeah.
So sorry.
Through Dr.
I'm st-
Matilda, I think Dr. Matilda will
Yeah.
help me.
Yeah.
yeah.
Yeah. Ask
And
Matilda, we met at Blakehurst. It was when we went to I think I went to do a health fair there.
yeah.
Yes.
Yeah.
Yeah.
When
Dr.
Thank
O,
you.
30 seconds, please. Mama, you
Yes.
also need to continuously remind him what Dr. O just said. Because he
Okay.
sees himself as a broken good, that is not a broken good to
Yes.
be fixed. You need to remind him what he did for the country. You need to remind him of his strengths and all of those things. And I think they have what they call a group session. I don't remember the exact word, but fellow veterans, he needs to be in, 'cause unfortunately, that's the way the country treats the veterans. But their fellow veteran group, Dr. O, what would that thing be? Group? Is it group therapy?
No,
Huh?
they have,
ABA group. It's called ABA group.
Okay. Yeah. Because he needs to be in an environment where he knows that he's not alone.
Mm-hmm.
yeah.
But
It's
he's
not
on drug. That's bad.
what kind of drug?
I don't know. He's calling. I don't know. I never see
It's quiet.
drugs.
It's
It's
quiet.
all right. That is also, it's a way of treating himself. He wants to get out of the misery. He wants to get out of here. So substance use can take him away for a bit, but he wears out.
He said
And
he's taking fentanyl, something.
fentanyl. Okay, fentanyl is a bad deal. Bad deal. But see
Mhm.
what it does is it will take him away from how he's feeling for a
Yes.
bit, but it wears out and then
Temporary fix.
more temporary fix.
Exactly.
So
Exactly.
when Sister Ellen Toppin asked that question, I was going to answer, but we had other things that overlapped. She asked the difference between substance use disorder and substance induced disorder. Substance use disorder is when somebody uses any kind of substance. It could be heroin, cocaine, marijuana, um, fentanyl, what have you, alcohol. They use it. It's to suppress something. It's to take them away from the present. And once they continue to use it, when it wears out, then they need more. They go into withdrawal. Also, they get dependent because they start requiring higher doses. So they get into withdrawal when it wears out. They need more, so they go for more. So they're living on it. That's substance use disorder. Substance induced disorder is when that substance use now becomes mental health. It becomes a medical issue.
Mm.
So that substance has induced a problem. And all in all, taking that person away from the substance use is what is important. The deal, though, is to be honest, the person has to be ready. They have to hit that bottom rock where they decide, okay, I'm done. This is not the life I should live. But the reason it probably, most likely, turned to drugs, to fentanyl, is because it's trying to self-medicate. And again, that is where medicine differs totally from sociology. Get that person on a stabilizing medication, they will not go to substance use.
I think what I have to interject here because this is where sociologists say you don't run to medicate people. One of the problems I had a lot of veterans in classes sometimes. They started with medication and then the medication keep increasing the dosage.
Yes.
And then by the time they realize it's just nothing is working anymore, the immune system is destroyed, so they go to the street drugs, which is the thing is stronger, and then it messed them up. So I think I understand sometimes we look, there's something, one of the things we say in social science, I say here before, and I'll repeat it, there's something we call the fallacy of authority, right? When we are dealing with behavior, we have to understand that it is not necessarily a medical condition per se, unless it is something that is genetic or biochemical. Even if it's biochemical, then we are dealing with people who will say, okay, he's doing drugs and we have to detox him, remove him from the drug environment. What we see in this society is that this when I know it seems like we pick on medical doctors, is when medical doctors were brought in to deal with behavior rather than psychologists and biosociologists, So everything now become, okay, we give them a little bit of drug to kind of control the nerves. And then what happens is that everything, and they become addicted. And then you may prescribe, say, take one dosage, they will go on and take two or three. And before you know it, it's become an addiction for them. And that's why some of them go back and looking for more. So what we say for us is that the best way is to one, get the family to talk to them about what they are going through, remove them from the environment, get them involved with friends or activities like somebody said, that's sociological thing. But drug should never be the beginning of saying, okay, you have this anxiety, so let's give you medication to calm you down. The idea is that let's calm them down. It is very dangerous, and that's what sociologists stand. And I think a lot of psychiatrists are saying the same thing nowadays, because we have been, there's one psychiatrist that wrote The Drugging of Children. There's something called The Drugging of Our Children. So we need to focus on family, getting family together, go back to the culture of sharing, culture of caring. No, we are even our children today is like the easiest way to be the parent now is medication. Okay, he's not hyper, let's give him medication to be quiet. That's dangerous. That's what sociologists say. The idea is that we need to remove medication away from parenting or caring for our people who have issues, anger issues, any kind of issue, marriage issue.
Thank you.
Thank you,
so much.
Doctor. Thank you. You're welcome.
Yes, thank you. Dr. Ogunleye, kindly unmute.
Hello, Dr. O.
Hello, my darling. How are you?
Hello, I'm fine, thank you. Hello, everyone. Um, what I'm going to say is very unpopular, especially in today's modern world and Western science-dominated world. So, for this reason, I'd like to issue a disclaimer. Anything that comes out of my mouth has nothing to do with Dr. O or Professor Ahmadu Baba-Singhri. This is strictly my opinion, okay? Now, I heard talk of kids with autism. I'm sorry, I'm at a charger and I just got burned. I hope you can still hear me.
Yes.
We can hear you, yes.
Okay. So I heard talk of kids with autism, and I just wanted to make it clear that not all autism is mental illness.
None of it is. None.
Okay.
Zero.
I'm glad.
No,
I'm
we
glad.
said it. Okay, autism and ADHD are not mental illness. None
Great.
of them.
Okay.
That was
Great.
answered.
Okay.
Yeah. It was a
And
question in the chat box that are they mental illness? And we answered they are not.
okay.
Yeah.
And I also want to add that sometimes parents are overly agitated by autism. There are children. First of all, we're Africans here, most of us, right?
Yes.
So unless you're a complete atheist who doesn't believe in anything outside of the physical, majority of us believe that we are part physical, part soul, part spirit. Yeah. And so when there is, and some of these kids with ADHD in Yoruba culture, they're called akondaumo, meaning they are special beings and they came with special powers to this world. And if this guy hadn't fall our hands, what's his name? This Tesla guy, this guy that made this car that I'm sitting in right now. If you hadn't fall our hands with his politics, he'll be a perfect example of an autistic kid with a special gift. And there are many like him. And I'm talking about this Tesla guy. There's this young man.
Elon Musk.
Yes, yes. There's this young man also in Texas. He's in some remote area of Texas. In fact, he moved to a remote area in Texas, specifically bought this property because it is a very old property, almost ancient. And he renovated that property from scratch, including the electricals and everything. And guess what? He's not getting his electricity from the grid, not from solar. He harnesses his power from the atmosphere. No wires. I'll try to look for
Can I
his.
invite him to Nigeria to come wire our houses?
I will try to look him up again on YouTube and share it with you, Dr. O. He is
Please.
an Akondamo, a special being. And there are many like him who have made discoveries, no, not made discoveries, who have brought knowledge to our earth that people are discounting, people are seen as crazy. Oh, he's autistic, he's just imagining things. No, they're not imagining things. They brought knowledge for us, if only we'll listen. And I want to now pivot to mental health. Because we are both part physical and part spirit, sometimes the cause of mental health is not just brain function. It's when there's this misalignment between your physical and your spirit, you fall into a gray area, a twilight zone, and that can be seen as mental illness in our world, right? And Western medicine cannot treat all of those. Mental medicine focuses only on the physical, on the brain synapses, on the brain firing and stuff. It doesn't treat that. So if you have been from pillar to post, from hospital to hospital, you might consider going back home for the solution for this problem. When I say going back home, I mean going to our own traditional medical practitioners, right? I know the West loves to call them shaman, medicine man, witch, wizard, whatnot, all kinds of labels that will make them sound like crazy people. But I like to call them traditional medical practitioners. Before 400 years ago, when these people came to our shore, we were taking care of ourselves. We were setting bones, we were doing surgeries, we were taking care of our mental health, we were doing all kinds of things. Then in came Western civilization and moved us away from our ancient traditional science. So if you have tried Western medicine and you're not getting result, I will encourage you to try our traditional medicine. Thank you.
Thank you so much.
Thank you so much. Appreciate that. Love your input. Bridget, you have your hand raised. Nkechi, kindly unmute if you have word to say. Well, I have questions in the chat box since Nkechi cannot unmute right now. There were lots of comments.
Dr. O, I had raised my hand, but because other people
please
had
go
their
ahead.
hands
Go
up, I
ahead.
took mine down.
Go ahead, please.
But I glad I waited.
Yeah, go
I
ahead.
didn't catch the name of the person who just spoke.
Dr. Ogunleye, Dr. O
Okay.
in California.
Okay, Dr. O in California.
Yes. She's a Suya woman.
But she sounds like a sweet woman. So, but but my question.
Oh my God, that's so stereotypic. What do swear women sound like? Man.
She said she sounds like a sweet woman.
Sweet
Oh,
woman.
sweet.
Sweet.
Oh, I thought you said
Sweet.
Suya. See
I
now.
said she's a
Thank
Suya
you so
woman.
much, ma'am. Thank
See
you
how,
for the
see how
compliment.
information gets carried off. Sorry.
Yeah, I know.
I don't even know what a sweet woman is. So anyway, so the question I had earlier was, so often because of culture, if a child acts a certain way, we sometimes, maybe none of us here, but we sometimes in our society, we hide that child away, thinking that the child has a mental condition or something is wrong or something the parents did or whatever. And so we hide that child away in the home, and it ends up where that child now develops, I don't want to say a mental condition, but that child develops into somebody that cannot function in society. And then back to Professor Baba.
Yeah, just Baba, that's fine. Yeah.
Back, I like give people the titles. You earn that degree, so I'm not gonna take it away.
Just Baba.
So Professor Baba raised how we label people, and these stereotypes often impact their very existence. So my question to all of us here, some of you work in the field and etc., etc., how can we as a people use the knowledge that we have and all of the exchanges we have heard here tonight from, how we treat children with ADHD. Um I teach children's church, and I can tell you I have lots of kids that come where they say, oh, they have ADHD, oh, they are autism. And I was like, oh, she says, oh, the director says you're gonna have 2 or 3 in your class this morning. How are you gonna cope? I'll be just fine, right? Because I learned how to deal with them. But that's just an example, little interjection. But how can we as a collective take the knowledge we are gaining? I'm an educator. Dr. O will tell you that. And I'm always looking for how we can take the education, the knowledge we get to make our societies better. So what can we do? We understand that sometimes even with the very um, FDA testing of some medications, the clinical trials are not done with people who look like us. And the results will not necessarily give the results we expect. So, how can we advocate not only for right testing, if you will, or testing against people that look like us, but how can we take the information to help our communities not to shut away these children when we think that they're autistic or we think they're ADHD or we think whatever, right? How can we use that knowledge? I'm going to stop there.
Well, if I may respond, I think that's a great question. Knowledge, as they say, is power. And but also, I also say that critical analysis of whatever information you get is very, very important because it helps us understand where things are coming from. What I have observed for some of us, I would say, is that sometimes we have like people come up with a blueprint of saying this is the way things are. Therefore, everybody is doing it. Therefore, we all have to do it without really critically analyzing the motive behind those ideas given to us. We back on there's a very common saying. I mean, Hillary Clinton wrote it in a book. It takes a village to raise a child. The problem in Africa that we have actually destroyed that. Because we have destroyed that, we have embraced just like somebody said, the Western culture that say everything now has to go scientific into treatment or go to this treatment, rather than trying to answer the question, try to address the concern at home. We push them to medication. Again, we still believe that medication is over. We have over diagnosis of children with quote unquote certain disorder or whatever it is, and then we have over medication of children. I mean, most of you today, most of these students who are acting up, studies have shown that they were medicated as children, and then when they grow up without natural immunity, to deal with any kind of adversity. You know, we are human beings. We will always come in contact with something that we don't like. You may get into a relationship that is perfect. After a time, it will become imperfect. So we have to learn to understand that. That's human nature. But when we look at it as, oh, because there's a problem with the person or with me, and therefore I need to go and get some medication and come back. It's like saying, well, why don't you allow them to go and do marijuana because they say marijuana calms you down? Well, no, you can't go to marijuana because of crime. But then, okay, we can prescribe you some medication that you go to a pharmacist and get it. Okay, that's fine. This is where we have to be realistic about life. So sociologists say that we need to be realistic, that humans will have some drawbacks in life, but it's not because they have some kind of a mental issue that is not natural. Anger is natural. Happiness is natural. Joy is natural. Everything has an opposite. That's why God created us with the opposite of each one. So I think we can look at the culture, you know, how we used to raise our children without medication to the now the culture that we raise our children with medication and they still not behaving very well. And I will really discourage any parent if they are recommended medication. I think I would discourage that because it may be harmful to them. That's my observation.
So we have some comments in the chat box that I'm gonna share. Our sister Denise Albright said, that's a relief that we all have some level or degree of mental health illness. We need to communicate this more to reduce the stigma. Perhaps more will reach out for support. You know, even sociologists are number one in this spectrum, in my opinion, with the conspiracy theory and all of them. So Dr. Alu says,
Okay, keep picking on me.
I'm telling you. So
That's okay, Doctor. Oh, I understand.
Dr. Alu says, if happiness is an accepted societal behavior and wealth is one of the sources of happiness, why do wealthy people suffer depression and mental illness, and some even commit suicide? How do sociologists describe the anomaly? I want to hear this one. Okay.
Okay, simple.
Okay.
Rich,
Good. 2
rich.
minutes.
Yes. I think again, money. There's a common saying that money doesn't make you happy. Money may give you freedom, may give you those freedom to not to be constrained, but it doesn't make you happy too. Rich people, I think I'll go back to this thing where it's a many men go and they say they were happy before they get married. When you're in a situation, rich people, some people will say they marry, maybe they marry trophy wives, and they're therefore not, maybe they're not happy. And they start taking drugs. Most of them take drugs to calm them down. At the end, they end up committing suicide. So it's the situation that they're in that they don't share, because it is a stigma to share, because they will take you to mental illness, and then you are now labeled that you went to see a psychologist, and you are seeing a mental health psychologist. So that stigma alone make them not willing to share their problem. And besides, they are rich. People look at them outside and praise them, but inside they are burning. So it's the label that they run away, the labeling and the stigma that they run away, that actually make them become more depressed, and they feel helpless and commit suicide. Yes. So
They
money,
suffer in silence because of status.
yes, exactly. The silence of the status, exactly. So I think that's what thank you so much. That's an excellent observation. The silence of the status.
Thank you.
Yes.
So Dr. Oduyebo says he's very concerned with
I
this.
want to add when you finish that, please.
No, go ahead. You say, I'll
Yeah,
yield to you.
yeah. So
Back to you.
it's a misnomer to think that only rich people, because they're rich, they commit suicide. No, poor
No, no.
people commit suicide.
Yes.
No,
Everybody.
it wasn't saying that. It says that, let me read the question again.
Yeah.
Let me read it again. It said, if happiness is an accepted societal behavior and wealth is one of the sources of happiness, why do wealthy people suffer depression and mental illness, and some even commit suicide? He's just looking at that population of wealthy people. Especially, these are people in Hollywood. We've seen quite a bit of those.
Mm.
And he wanted to know what sociologists describe, how they would describe this anomaly.
Yeah.
So that was the question.
Okay. So whether rich or poor, everybody have their psychological conditions. So you can't look at rich people and then say because of that you don't want to get rich. So God just humbles all of us to say that some of this situation is not, it's not just about poor people. It's not poor people. People who have access to medication, they still have their own psychological issues. So clinical depression is real. A lot of these things, severe trauma is real. And yes, God is not a respecter of any financial status. What hits the poor hits the rich. It's just like saying that pastors are perfect or imams are perfect. No, they're still going to go through their own ups and downs, no matter what kind of level of access they have to God. So you get help when you need help, rich or poor.
Mhm, Thank you.
And
Dr.
you are always
Oduyebo,
tell it to be truthful to yourself. Be truthful to yourself. It's the easy.
thank you. Dr. Oduyebo says is very concerned with the social perspectives of Dr. Ahmadu. I second you on that, Dr. Oduyebo. And Madam Lara, Madam VP also seconds that.
But I will be glad to hear her concerns. That's fine.
You know
That's why
what,
we're here to dialogue. The dialogue. That's why.
Dr. Oduyebo, you don't want to even know. You should go back to the YouTube past episodes where Dr. Where Professor Bapak and I, with Dr. Aluya, I think it was, got into this thing with past medical history and all of that. Oh my gosh, don't let's start that one. It was very interesting. So, Dr. Fawale reiterated that autism and ADHD are not mental health issues, they are neurological developmental disorders. And Sister Ellen Toppin said, Nelson Mandela said education is liberation, which is true. And that's why we're here tonight.
Yes.
And Dr. Mayowa said it starts with all of us being more inclusive, confronting assumptions, and raising awareness. 100% on point. Dr. Guleye added that imbalance causes mental health. Life requires balance. Excess of anything indicates imbalance. Nature abhors imbalance, and that is true. So, balance is very important in our daily lives. Thank you so much for all this, educative chiming ins. This has been amazing. And I love to have Professor on Medical Mondays with Dr. O because our perspectives are so different in sociology and medicine. So I just want to say, though, that from all Baba has been saying, it is important to note that mental health medications that we prescribe as allopaths are not drug of addiction. None of them is actually addictive. They're not like it's not like alcohol, like cocaine, heroin, and stuff like that, fentanyl, that causes addiction, that causes dependency. They are not. The only one that I will suggest to be careful of are benzodiazepines, and to be, to eat it or more, your Xanax, Ambien, stuff like that. They are they are excellent medications. And see, I prefer not to call medications we prescribe drugs. They are medications. They are excellent medications for anxiety, but they should be used only for short-term purposes while you're stabilizing the patient. So if you are on a benzodiazepine, please talk to your doctor. For long-term purposes, they're not the healthiest to take. And another thing I want to point out is mental health medications do not, I repeat, do not affect immune system. They don't. They don't work on the immune system. They don't affect the immune system. And it doesn't matter what medication one takes. It's best to have the right diagnosis and to give the right intervention. Some people have high blood pressure. It has to be diagnosed. And medication is important to take. Please do not listen to the, sociologists who blindly say don't take medication, or the stigma they've attached to, diagnosis, especially mental health diagnosis. I do agree with Prof that counseling is important, family is important, friends are important. Get people in your circle that you trust, that you can talk to. It's very important for all of our mental health. I'll repeat again, and Madam Lara, thank you for agreeing with me that everybody has a level of mental health, something, mental health disorder. And it's the level that is different and how you can control it, whether you're able to control or not control it. Everybody can get angry. I have situations that, oh my gosh, people around me look at me and say, I can't believe you. How come you didn't get angry over that? There are situations that will blow your mind but I choose most of the time, and I'm not perfect, but I choose most of the time not to get angry. I choose most of the time to act and not react. But don't be deceived that I cannot lose it. I can, and I have. Being angry, it just takes a lot to get me there. That's my level. Some people have, they short fuse is what I call them. They get angry easily. And in some instances, you know what? They may need treatment, Baba. They may need treatment because their anger has gotten to another level
Make,
where
what makes
they will
what
be
makes them
considered
angry?
mental health.
Yeah. Well, question is what makes them angry? What did you do or what did they do to make you angry?
Everything. Baba, I'm thinking of one person. Honestly, I'm not kidding you.
No, no,
This
no, I made
this
it. No, no, no,
person
no, no, I made
is an African man, and he
it.
gets upset over everything. It doesn't matter. Look, you can start
So he may
an
have
afternoon.
low, so that's why I say he may have low MAO. He may have low MAO. So there you need to be diagnosed. But what I was saying that
Okay, let me give you this. What if it's not low MAO? What if
maybe he
it
has
is that
is experiencing something that he's not sharing with people.
no, what if it is just poor coping skill? Because it is. And
I,
for him, I can tell you, he doesn't have low nothing. He just feels um it feels like life should always fall on its side, and it is this way or no way. That's
Does
it.
he feel
Dr. O, he
rejected?
has to be in control. And when when he's not in control, that's where he gets angry.
Is that, thank you. You
Exactly.
articulated it very well.
Yes, it's a
So
control.
it is control. It
Right.
is not know nothing.
Yeah, it's control. Yeah, that's what we're saying.
Thank you.
When people
So
try to
for
control
me,
you,
that is the problem. And I agree with you that, um, it is not controlling, it's anger. But guess what? No friend, no family would help him because he's not going to listen to them. He's not going to benefit from, he has great people surrounding him, excellent people. But you know what? Everybody steps back from him because there's no point. It's a lost cause.
it could be the way he was socialized and how he, again, the way he was socialized and how he wants to be in control and he is not in control. He gets angry to demonstrate his frustration for not being in control. Again, people who want to be in control are always angry. It's like I said, like domestic violence. When somebody hit, it's not because they know what they're doing, but they want to be in control at that moment. And
You know what? The word I was looking for is what Dr. Ogunleye wrote here, entitlement. Control, entitlement, entitlement. That is
power
it.
and control. Yeah, power.
That is this person.
Yeah,
So
power and
you
control.
cannot tell me, but guess what? I have medication I can put him on that will control him. But you sociologists will say, no, this one is a lost cause. It's not gonna, no friend, no family is gonna be able to help him. But medication will control him.
As
There
if,
is a place
okay,
for everything.
let me ask you a question. Does he fear the law?
Does he fear the Lord?
Does he fear that if he hits somebody, he's going to go to jail?
Does he fear the law? You know what? I think he does.
Okay, so that means he knows when to act. He knows when to act. So he has to.
You know what? I said I think it does. I wouldn't say I even think. No, I believe it does because he's actually very scared of the law. He's chicken.
Exactly.
This person is
Oh,
actually
he
when
knows
you look at some aspects of him, he's so
exactly.
chicken.
Exactly. So he knows what he's doing. He's trying to get his way, and if he doesn't get his
Entitlement.
way, then he's gonna start being angry, so trying to intimidate people. That's what they do, is intimidative tactics for power and control.
Well,
So, Dr.
thank
O,
you so much.
I do have to drop. So my last
Yeah,
comment about that man you're talking about,
yeah.
besides control and entitlement, I think he likes to manipulate the situation
Yes, thank you.
so
That's
that
true
he is
too.
in charge. But
That's
as
true
I
too.
drop,
Yes.
I
That's
thank
true too. But you know what? We're concluding. I just want to thank Baba for this robust conversation and for bringing us to talk about it because these are topics that people don't want to talk about. I love sociologists for the fact that they bring that perspective, and I love to rebut them. So
But that is good. That's why I think that's what it's supposed to be. And I have to admit to you, I think that, yeah, sometimes when we come here and everybody's agreeing, then I say, what are we learning? You know what I mean? So it's good to challenge, and I think that kind of make the conversation more informative and educational. So I think
I appreciate you beyond words. Thank you so much. And thank you for even suggesting the topic and seeing the need for us to discuss this and to discuss the stigma associated with mental health.
well, thank you for giving me the opportunity to present my crazy topics. Conspiracy.
I love it. I love it.